Hello everyone, welcome to my channel. Today we have another allergy and immunology question. If you like more step 2 questions like this, please like and subscribe. A 20-year-old man presents with progressive shortness of breath and a chronic productive cough for several months. Over the past 3 years, he has experienced multiple episodes of bacterial sinus infections and recurrent lower respiratory tract infections requiring several courses of antibiotics. Although his symptoms improve with treatment, they tend to return within a few months. He has no history of smoking, takes no regular medications, and has tested negative for HIV infection. Physical examination is unremarkable with no enlarged lymph nodes or organomegaly. Laboratory studies show normal blood counts and normal kidney function. A chest CT demonstrates areas of interstitial lung scarring, and imaging of the head reveals chronic inflammatory changes within the paranasal sinuses. Which of the following is the most appropriate next diagnostic test? First, we need to make the diagnosis, and we have a young patient, 20 years old, and we are seeing recurrent sinopulmonary infections as well as some lung scarring, potentially due to the infections. And whenever we have a young person with recurrent sinopulmonary infections, it's useful to think about common variable immunodeficiency, because common variable immunodeficiency tends to happen in individuals aged 20 to 40 years old. So with that in mind, let's go and answer the questions. Serum immunoglobulin quantification. This could actually be used because in common variable immunodeficiency disorder, the IgG, IgM, and IgA levels are actually low. So this could potentially be used to detect for the condition. And I'm going to read the other answer choices too. B, peripheral blood immunophenotyping. This could also be used to measure the levels of B and T cells, and B and B cells alongside IgA, IgM, and IgG levels are low in patients with X-linked agammaglobulinemia. And that condition usually happens with patients who are very young. I'm talking about infant boys. And right now we have a 20-year-old patient, so this doesn't really apply. C, alpha 1 antityrepsin level measurement. Alpha 1 antityrepsin deficiency could lead to liver damages as well as lung damages, but the CT scan of the lung would potentially show large air spaces in the lung, not what we are observing with this patient. So I'm not going to go with C. D, bronchoscopy with bronchoalveolar lavage. This could be used to potentially diagnose very general lung diseases such as pneumonia, but recurrent sinopulmonary infections and other symptoms we are seeing here really point at some sort of immunodeficiency. So I'm not going to go with D. E, mycobacterial sputum studies. This could be used to detect for bacterium pneumonia, but that doesn't explain the sinus infections. And I'm not going to go with E. I'm going to go with A. Thank you very much for watching. And if you'd like to see more of these videos, please don't forget to like and subscribe.